already.
All right, so what if the president suggests a nonprofit cooperative compromise? You've heard about that. Would that change any GOP minds? Republican Senator Roger Wicker from Mississippi says no, this would just be a backdoor way of the public option anyway, and the government getting involved in a big way. So, Senator, if the president were to say tonight, well, I've got this cooperative thing in my hip pocket, you're saying, well, keep it there.
Well, for one thing, I don't think the president's going to say that. But if you totally resolve the government option or the backdoor way, which is the cooperative, you still have a $500 billion cut in Medicare. You still have Medicaid mandates on the states that will absolutely require tax increase or budget cuts across the board in almost every state. You still have the CBO saying this plan is going to run people out of jobs. It's going to hurt small business. You still have the tax increases at the federal level. There is just so much wrong with this plan.
But what if there are no tax increases at the federal level? What if the sphere tax on wealthier individuals doesn't materialize? It's largely paid for by, at least from the early plan, look at the Baucus proposal, tax hikes on HMOs and health insurance companies and the drug makers of the $3 billion tab, that's how you get to pay for this and on top of these so-called savings. You're not buying into that?
No, I don't buy it at all. Absolutely. There's no way you can do this plan. There's no way you can spend $1 trillion over a decade and say it's not going to either cause huge cuts in other programs like Medicare or huge mandates like in the Medicaid mandate against on the states.
Well, the analogy I've heard, Senator, is that this would be Medicare on steroids, pardon the mixed metaphor, that if you like Medicare, and most people when they're 65 and over and they talk about Medicare, they like it. You know, I don't know across the board, but by and large. And the president will try to say tonight, if you like Medicare and by and large you like how it protects you and helps you and covers you, you'll love what I'm coming up with. What are you going to say?
Well, I'm going to say we need to protect Medicare. My dad's on Medicare. Medicare is going to go broke unless we fix it. The last thing we need to do is take money away from Medicare to start a whole brand new entitlement.
They say it wouldn't be taken from Medicare. You saying they're lying?
Well, I'm saying it's right there in the bill. It's a savings from Medicare. It doesn't go to shore up Medicare.
So this cooperative stuff and whatever other savings they're expecting and middle ground they're looking at and efficiencies they're going to extract from Medicare, you're saying is not worth the paper it's written on?
Well, I'm just saying there's no way to save the bill. At a time of economic recession.
It's going nowhere.
Well, as far as I'm concerned, and I don't think
he's wasting his time going into it.
I'm always willing to listen to the president. But what I wish the president would say is, we can do things that don't cost anything. We can do medical malpractice reform. I don't see how he can say that with the trial lawyer base.
Or what if he throws that out to you, Senator, that, you know, I might consider something like that?
Well,
deal changer?
I'll be delighted to talk to the president about something like that would actually go to why healthcare costs are increasing. But let me see the legislation. All of the proposals so far spend $1 trillion, and really that's a low estimate, and they don't get to the problem. So show me the legislation on medical malpractice reform.
So real quickly, Mitch
McConnell,
I know you did. Mitch McConnell says we can't be the party and no, we'll start from scratch or should start from scratch, but it's not a wise strategy, I'm paraphrasing here, Senator, for Republicans to be the party opposing everything. What do you say?
What brings down costs in the United States of America? Competition. We don't allow competition in healthcare. Let's open it up to state, across state lines. Let's have association health plans, and let's try what's worked in every other product in the United States of America, and that won't cost a penny.
Senator Wicker, very good seeing you.
Thank
you very much. I know we'll be seeing you in that fine building behind us later tonight. So what would Teddy do? I'm not talking about Teddy Kennedy. Teddy Roosevelt after this.